Let's talk about the sensory protocol that I have my patients do after a sensate breast reconstruction. I actually think that it would be great to do even if you don't have sensate breast reconstruction, but it's going to likely be more effective if you did have that nerve connection to encourage sensation return. So remember, most of your breast is going to be numb after a mastectomy because the nerves are cut. And if we're retraining the nerves, we want to be looking in a mirror, so giving your brain that feedback, and then we want to touch the breast strategically. So the first thing we do is going to be, you're going to divide your breast into 4 quadrants, and you're going to do just touch. So just touch to each area of the breast. The next one you're going to do is movement. So movement in each quadrant of the breast. Okay, so static touch, movement. The next thing we're going to do is ice or something cold. You're going to take an ice cube and just hold it there and feel the ice along your breast. And then the last one we're going to use is a bristle brush. So basically like a toothbrush, and you're just going to move it in each quadrant of the breast. So that whole thing takes 5 minutes. It's very fast, but it can encourage appropriate sensation return of the breast. This is something that we started doing in residency when we were doing face transplants, because as you can imagine, your face is numb after a transplant. So it was that same type of movement along the face, and then we just adjusted it for breast reconstruction. So I think that it can be a really great tool as you're kind of retraining your brain. Once again, it's low risk, it takes a couple minutes, it's worth a try. If you've tried it, let me know in the comments below.